Hello friends, Nerd Pediatrician here. Today we're going to talk about eczema, what it is and how you can care for your child's skin at home. Disclaimers first, this information is being presented for educational purposes only. It is not intended to diagnose or treat you or your sick child. Also, a quick shout out to Mrs. Nerd for creating this really cool t-shirt for me. Made me very happy, so thank you, Mrs. Nerd. Okay, so what is eczema? Well, eczema is also known as atopic dermatitis, and that gives us our first clue as to what it is. Atopic or atopy means a genetic predisposition towards developing certain allergic diseases like asthma, allergic rhinitis, or seasonal allergies, and eczema. My brain says explain like I'm 5. The way that I think about it is genetic changes ultimately lead to an alteration in the skin's ability to function as a barrier. So water loss leads to dry skin, and this dry skin is more prone to irritation and inflammation from certain triggers. So think allergens, irritants, changes in temperature, changes in humidity. The symptoms of eczema are dry skin, which is really itchy. You can start having inflammation, so you get red spots on it. Now, note that in people with darker skin, instead of being red, sometimes those spots are very dark or what we call violaceous. Itchy skin, or what we call pruritus, leads to the dreaded itch-scratch cycle. Itching leads to scratching, which leads to compromised skin barrier, which leads to inflammation, which leads to itching, which leads to more scratching. You get the idea. As the inflammation increases, we start seeing cracked skin and oozing skin. Where does eczema occur? Well, it's highly variable, but we tend to see classic trends by age group. So in infants, a lot of times we'll see the face involved, also the knees and the elbows. In slightly older kids, we see typically involvement of what we call the flexor surfaces, so behind the knees or the inside of the elbows, also ankles, wrists, hands, feet, and neck. Eczema is a chronic disease. There's no cure, so the treatment is focusing on symptom management. I like to break this down into daily prevention and skin maintenance, and then we'll talk about treatment when the eczema starts to flare. So for prevention, we want to have a really good moisturization routine. Using things like lotions, creams, and ointments that are bland and fragrance-free is going to be your best bet. Now, as a pediatrician, I always like to recommend ointments over creams and lotions because they're much heavier. So think Vaseline, Aquaphor, things like that. They stay on the skin much longer, especially in active kids that are running around and sweating. We recommend limiting bath time to 5 or 10 minutes and using water that's lukewarm instead of hot water. And here's a pro tip: when your child gets out of the bath or the shower, you want to pat them dry instead of rubbing and leave that skin wet, okay? A little bit of water on the skin, and then you want to put on that ointment right on top of all of that water and kind of lock that water in. Another aspect of our prevention game is going to be avoiding triggers. So if they have known allergens and then also irritants, just breathable clothes like cotton and using very mild detergents. Also, when you're bathing your child, you want to use a mild soap that doesn't have fragrances. I always like to recommend Dove. We want to control the itching and the scratching as much as we can. Some kids will benefit from a daily antihistamine. You want to keep their fingernails really short, so when they do inevitably scratch, they inflict less damage on their skin. When your child's eczema begins to worsen and have what we call an eczema flare, you want to really increase your moisturization game and then talk to your doctor about medications that can help. The most common medications prescribed for treatments of acute eczema flares are going to be topical steroids. Topical steroids come in different forms like lotions, creams, and ointments, and then also many different strengths or what we call potencies. These medications are considered very safe. However, they do carry the risk of some side effects, particularly related to long-term use and then the amount used. I recommend my patients to use what's called the fingertip unit when applying these steroids, and this really helps to standardize the dose. A fingertip unit is the amount of steroid that fits when you squeeze it out on the tube from the tip of the index finger to the first joint line here. And in an adult fingertip, that's going to be about 0.5 gram. Some really cool handy charts out there that will tell you, according to how old the age of the child, how much or how many fingertip units should be applied to a particular body part. So as an example, for infants up to about 12 months, 1 fingertip unit should cover an entire arm and hand. For really severe cases of eczema, your doctor might recommend something called wet wrap therapy, and I have seen this work magic even just overnight. Put your topical steroid on your child's skin, and then you take a soft cloth, so we like to recommend pajamas, soak them in water, squeeze them out so that they're moist but not sopping wet. Have your child put on the pajamas and then put on dry clothes over the top of that, and then let them sleep in that. And really, the changes by just the next morning sometimes are very remarkable. Kids with really tough to control eczema, there are other treatment options. So things like non-steroidal topical medications and what we call biologics. These are typically prescribed by dermatologists. So if you're having trouble getting on top of your child's eczema, talk to your doctor about possibly getting referred to a pediatric dermatologist. One of the more common complications of acute eczema is what we call superimposed infection. So because the skin is inflamed and your barrier is broken down and you might have excoriations from your child scratching, it's more susceptible to getting infected with things like bacteria and viruses. Another reason for infection is that science has showed that people with eczema tend to have an altered cutaneous microbiome. So we all have bacteria that live inside of us and on our skin. And those with eczema tend to have a decreased diversity of the different type of bacteria that live on their skin and increased population of things like Staph aureus. Follow these tips to stay on top of your child's eczema. And as always, if you have any questions or concerns, or if your child's having a bad flare or you have concerns of infection, reach out to your child's pediatrician. Thank you so much for watching. I've got more ideas for topics, so if you're liking these videos, please hit the subscribe button. Don't forget to support your local library. Thanks again. Have a great day. Nerd Pediatrician out.